button, it has come. Yes, we have just started. Yes, the slides have come. Just hold on for a second. I will get back to Rohan sir, and then you can. We are all live. So Rohan sir, please start the session.
Okay. So thank you, Bismita ma'am, for giving me this honor to introduce today's speaker, Professor Monalisa Mukherjee. And when I was going through her CV, it was really very great, and I was very much impressed with the amount of work, with the quality of work what she's currently doing. And she did her bachelor's and master's from University of North Bengal. And after that, she did a PhD from Center for Biomedical Engineering, IIT Delhi, and then joined MIT University as a lecturer and risen through, assistant professor, associate professor. And currently, she's a professor in Institute of Biotechnology at the same university, and also director of MIT Institute of Clinical Chemistry Research and Studies. As far as her publications are concerned, these are some of the reputed journals of nanochemistry, something like Nano Today, ACS Nano, or Materials Horizons, or Green Chemistry, which are RSC journals. And because of our close collaboration with the chemistry over here, so I know what are the quality journals in this particular field and what she is doing. Apart from that, she has also a lot of grants, and apart from patents and different awards, invited lectures. So what I am thinking is, like, I should not spend that much time on that. Although those are some of the best recognitions what she has. But right now, her research focus is on diverse background like chemical biology, catalysis, material science, and drug delivery. And she aims towards the development of functional molecules of use to humankind with various approaches. And among them, the importance are like biomimetic or bio-inspired is one of the most significant routes what she is currently working on. And she's also trying to introduce artificial molecules into living cells to examine the chemical reactions within the living organisms. She conducts research at the intersection of chemical, electrical, and biological engineering, as well as material, biological, and physical sciences. The major aim lies in exploring innovative technologies in nanoscale manipulation and design at a molecular scale, which has the potential for societal impact in areas such as energy, healthcare, and the environment. And as far as the theme of this conference, what Bismita ma'am is organizing, it fits really well. And based on the diverse field, our institute with respect to different departments what we have. So I think so many of the faculties over here, they will also be very much interested in listening to her talk, and they will also be benefited with respect to the amount of experience what she has got. And I once again welcome ma'am on behalf of our department and also institute that you took some time out of our busy schedule, and you be with us online. Although we wanted you to be physically present out here, but due to pandemic and all, so I think so this is also not a less opportunity for us to interact with you and listening to your talk. So once again, we welcome you all, ma'am, for this particular session, and we will be really interested to get to know about your work, what you are doing in MIT. So, Professor Mukherjee, please.
Thank you so much, Dr. Rohan, for this kind introduction. And very good morning to all of you. As Bishmita, I am very, very nostalgic now because it would be my very good privilege if we could have met in person. But yes, of course, due to pandemic, we are not able to meet anyway. But it is nevertheless, we can talk, we can see each other because of such internet facilities and all. So it is my proud privilege and honor to get an opportunity to talk in this forum. So I'll not take much time. I will just start. So the title of today's presentation is An Unexplored Avenue of Self-Assembly in the Genesis of Exotic Nanostructures. I will be talking about wound healing. I will be talking about drug delivery. I will be talking about antiviral materials. But all these things we have come across with the help of exotic nanostructures. So today's presentation is basically focused on this unexplored avenue of self-assembly in the genesis of exotic nanostructures. So as we all know, look deep into the nature, then you will understand everything better. And organisms are formed through self-assembly. Biological systems elegantly modulate self-assembly with a great precision. The origami of self-assembly is being used in material science that emphasizes on initiating the generation of artificial platforms influenced by nature. So material science is basically a snapshot on the way from fundamental science to societal impact. As truly spoken by Dr. Rohan that yes, I'm working with nanotechnology, catalysis, click chemistry, biomimetics, but my area of research is, if you combine all of them, is materialobiology, which is a new terminology which has come in 2 3 years back. So I believe that if you assemble all of them, it will go and merge into the materialobiology. So before going into the depth, I should tell you what is self-assembly. And we are really in the midst of large system paradigm shift driven by accelerated exponential growth of new technology. And we witness to faster, more comprehensive change shaped by new technology than any civilization in history.
Monalisa Didi, sorry, Dr. Monalisa, sorry, just sorry to interrupt. Can you
Yeah.
just be a little bit louder? I think we
Okay.
are,
Okay.
or maybe you have to increase the volume
Yeah,
session a little
maybe,
bit.
maybe, maybe. Just a moment. Just a moment. Okay, maybe the volume has to be increased. Yeah. Can you hear me now, Vishmita?
Yes, yes,
Fine.
yes.
Share the window. Okay. Wait. Now again I have to share. Just wait. Just a moment, Vishmita. Huh?
Yes,
Yeah. So is it fine with the, all of you? You can
yes,
hear now? Okay.
yes.
Fine. So let me move to the next one. But it is not moving. Why it is not moving? Yeah, it's fine. So as I told you, we are in the midst of large system paradigm shift driven by accelerated exponential growth, and that is of new technology. We are witness to faster, more comprehensive change shaped by new technology that any civilization in history. So this is the beginning of a wave of technologies such as nanotechnology. And I take the pledge to go ahead with the help of material biology and nanotechnology together to meet the economies and societal problems on a global scale. So nanotechnology is a continuation of the next chapter in the acceleration of advanced technology, and perhaps more importantly, it may point out towards the transformation of future global economy. Now, what is self-assembly? Because I said that self-assembly in the genesis of exotic nanostructures. So the term self-assembly can be understood from its two components. I'm just starting the video, but you guys may be able to see it, but you cannot hear it. So, so the term self-assembly can understood from two components. First component, self implies spontaneous and on its own, which suggests that it process and that happens without human intervention or operation from outside of the system. And the second component of self assembly indicates that uh, forming of the molecules together, and it may be dynamic, it may be static. So now we have learned about the self-assembly without human intervention. Now, why exotic nanostructure formation is so difficult? Because facile control over the spatial arrangements of nanoscopic building blocks in the bottom-up synthesis of functional materials, high level of complexity exists with structural precision where independent control of polymers remain an unmet challenge, growing the bottleneck of precision assembly while designing well-ordered nanostructure across the length scale, well-ordered nanostructures with sub-nanometer range, that is 10 nanometer range, or lower than that with lower symmetrical topologies, and materials fabricated with precisely controlled anisotropy orientation and topology, molecular functionality, and hierarchical self-assembly are still at their infancy. So that is why the formation of exotic nanostructures, and exotic means something unique, something unnatural. So fabrication of exotic nanostructures using synthetic polymers. So as I told you that it is very, very difficult, but if you can select proper monomers, then these monomers can guide towards a proper self-assembly that hardly polymer chemists go and understand until and unless you go to the depth to understand the mechanism with the TEM, with the AFM, it is very difficult for you to go ahead with this type of things. So the fabrication of exotic nanostructures using synthetic polymers for biomedical applications. For that, graphene carbon nanotubes are there in biomedical arena, friend or foe. So going to that, we have studied this current biology. So this identical routes to malignancy from this carbon nanotubes with the help of carbon nanotubes. Then we have gone through nature nanotechnology, promises, facts and challenges for carbon nanotubes in imaging and therapeutics. We have gone for the science paper, toxic potential of materials at the nano level. We have gone through this chemical review paper, understanding the toxicity of carbon nanotubes. Then we went for this another paper in Journal of American Chemical Society, functionalized single-walled carbon nanotubes as rationally designed vehicle for tumor-targeted drug delivery. We went to this ACS nano multi-walled carbon nanotubes functionalization with high molecular weight, hyaluronic, and significantly reduced pulmonary injury. And based on that, then we thought, okay, there are problems with graphene or graphene-like materials. Why not think something which will be compatible with the system? The toxicity will be lowered. Then we went for fabricating a molecule, a polymer, that is with acrylic acid and DMA PMA. Questions may be arise that acrylic acid and DMA PMA have been of late used by scientists. They have been published, and in fact, it has been published in Journal of Applied Polymer Science in 2008 by my mentor in IIT Delhi, along with Anup Das, Dr. Anup Das as the first author. But they never looked into the system, that what is that inside. So when I looked into the system, into the nanoscale, went on doing the reaction till 24 hours, took the alicot of the mixture and went for TEM and the AFM analysis, I saw that it is a tube-like structure, and this tube-like structure has helix inside. So that inspired me. That might be it is some new molecule, some new not exotic nanostructures, because it is very unnatural. They have already said that it is a pH sensitive polymer. It imbibes at a alkaline pH, and it can deliver the payloads, the drugs, and it can help for the colon cancer or other treatments, or so many it has been reported. But nobody looked inside. So we, for the first time in 2019, it is not like that in the 2019 we started the work. We started the work in 2015. We went across, we have done XPS, we have done XRD, we have done TEM, we have done AFM, and then we tried to understand the mechanism for the formation of these exotic nanostructures, that is hydrogel nanotubes with ice helix. So that we have shown with this morphology. First, the sheets are formed, then they buckle out. And in buckling out, there are structured water which are inside, which are trapped inside. And this structured water then forms the ice helix, which gives the octagon-like structures which we are seeing here. And then outside the tubes which are rolled up, they are hexagonal, they have the hexagonal structures. Here you see, you have the very nice helical pattern, the ice helix. And here it is the hexagonal pattern that is for the tubes. So this all internal system has been achieved with the help of TEM analysis, and not also TEM analysis at 24 hours, but TEM analysis we have done at 1 hour, 2 hours, 3 hours. So nanoscale, apart from storage, delivery, and also may be used for achieving kinetics of chemical reaction, as it is better exemplified by nanopores in zeolites. We have porous, these are porous materials. So molecules confined in regions with dimension in the order of molecular size exhibits different physical behaviors compared to large space, having implications in chemical reactions, except for the obvious case when entropies effect are important. Reactions involving larger activation volume change are also affected by confinement in nano compartments. So I will pressurize in the area of nano confinement because that is automatically done. In our case, we are experimentally proving that, but some of the cases they have given the pressure from outside to achieve this nano confinement. So nano confinement is one of the important parameter to get the exotic nanostructures. And further shape selectivity and how the processed molecules, reactants, transition states, and products fit in confined area at nanoscale plays a crucial role for the occurrence of successful transformation. And in that respect, deriving nanomaterials with various shapes can lead to controlled enhancement of particular chemical reaction at their interior. So, with the paradigm shift towards better clinical management of diabetic wounds, because I spoke that I will be telling about the diabetic wounds or the wound healing. So, better clinical management of diabetic wounds, safe, effective, and economic materials are greatly required. Now, there are materials, but there are certain problems. So, to overcome the existing technological hurdles, we reported for the first time the fabrication of hydrogel nanotubes. You see, very nice tubes with the scanning electron microscope images. HNTs, we have called it, with ice helix, which I showed you in my last slide. The ice helix, very nicely shown, that address the great limitation of carbon nanotubes in the biomedical arena. Now, 2D polymer nanosheets with hexagonally structured ice locked into the polymer mesh was obtained by a free radical aqueous copolymerization. Just I go back, free radical aqueous copolymerization, which I told you. In due course of time, the alkyl side chains revealed unique interdigited packing. See, the alkyl side chains, they are going for the packing. They are going for the packing of the material. The sheets are rolling. So what is the mechanism of rolling of the sheets that we have given, that the alkyl side chains reveal unique interdigited packing in a confined geometry and crystallization pattern armed into a hexagonal rotator face stabilized by nanoscale confinement. Furthermore, at a particular temperature, the sheets buckle out of the plane in crystalline hexagonally packed HNTs. So these are the sheets which buckle out to form the hexagonally packed HNTs, that is the hydrogel nanotube. How? How they are inspired? By the ancient art of origami with high degree of sophistication, producing a seamless pattern. We envisaged that water inside the hydrophobic channels would freeze spontaneously, clustering into the nano-confined environment and providing a signature for the emergence of quasi 1D ice helix. Why I am telling quasi 1D? Because first it was the sheet, and then they buckle out, and then it forms the tubes. So inside you cannot call it is perfectly one dimensional, because the structured water which was there were two dimension, which they gave, then when rolled, the sheets were rolled up, they gave the signature for the emergence of quasi one dimensional ice helix. These hydrogel nanotubes ameliorated early wound bed restoration via reepithelialization, plasia, bolstering angiogenesis in diabetic Wister rats. A matured epidermal architecture with multiple layers of connective tissues observed by, just I'm showing that image first. Yes, this is our image which we have taken with the, and we have done with the animal models, that is the Wister rats. A matured epidermal architecture with multiple layer of fibrous connective tissues observed by 16th day indicate complete healing of wound. Okay, just a moment. Bishmita, can I take a moment? Bishmita?
Yes, yes.
Very sorry, Bishmita, and all of you.
Yep, it's okay.
Because somebody in the door and nobody in my house now. So I have to go. So the change in interfacial tension between water and electrolytic complex of DMA PMA.
Monalisa,
Huh?
uh, again you check with the sounds, so a little bit
Can you
low.
hear me? Can you
Yes,
hear me?
yes, now it is audible. Yes.
So the change in interfacial tension between water and electrolytic complex of DMA, EMA and acrylic acids causes the polymeric chains to associate, engendering precipitation of the polymeric complex. And then the congregation of these precipitates is guided by fissile amphiphysicity, where solvation-free energy of these assemblies become lower than the individual solvated molecules, which I said, and this preferential solvation of polyacrylic acid in water within the PADP complex limits the interfacial curvature between the hydrophilic corona and hydrophobic core, proving it to be the biggest player in the game of hydrogel nanotube formation. The flexible polymer side chains displayed unique interdigited packing, maximizing their van der Waals contacts and crystallization pattern, where the volume of the main chain was too large to take part in crystallization. So the distribution density and grafting degree of alkyl side chains with regular conformation along with the polymer main chains gave rise to this hierarchical self-assembly, forming extended two-dimensional 2D island. Then the extensive growth of embryonic polymeric layers was observed in aliquots taken after every 10 hours from continuous reaction, and they assemble to form pitcher-like architecture, which we have shown in these images. Furthermore, nanoscopic confinement crystallization behavior of the frustrated side chains were guided by the rigidity of the polymer main chain, affording different thermodynamic and crystallization behavior to the metastable crystalline phase. As the flexible side chains attained a critical length, they exhibited thermotropic phase transition behavior, packing into hexagonal rotator phase, stabilized into a nano-confined environment, and thus exhibit unique diffraction XRD for the HNTs. And the main chain primarily constitute the disordered phase, where the side chain crystallizes into the polymer backbone. So these are the reasons of the genesis of these exotic nanostructures, that is hydrogel nanotube, with the help and the structured water inside forming the ice helix, which has been proved with the help of TEM images and TM images with the aliquots taken after every 10 minutes, and also the ACM images. And then we have identified them with the several entropic and thermodynamic calculations. And these calculations fit with our images and the experimental results. And we confirmed this anisotropic growth via nucleated self assembly, accompanied by staggered stacking of nanocrystalline water, led to dramatic contraction of the corona volume due to uniaxial compressive force parallel to HNTs, giving rise to high degree of cooperativity, and confinement induced entropy give rise to this type of stable helical structures. So we have we have done this helical structures, we have seen this, we have used this, then now we have to understand the mechanical properties. So we have done the rheology experiments, which I will be coming later. But before that, what is the application of the material? So we went again back to the literature, because before any research we need to study a lot. Even we synthesize a material, we need to find out that what are there in the literature. Okay, this material is giving good result in wound healing. Now can it go for diabetic wound healing? So what are the existing literature? So diabetic wound healing, a perfect storm for small nick to become a life threatening wound. So when to study this applied materials and interface, they have used encapsulation of curcumin nanoparticles with this thermosensitive hydrogels, improved diabetic wound healing, but they took 20 days. Then we went for this ACS polymer, again ACS applied materials and interface, bioactive injectable hydrogels containing this bioglass for diabetic wound healing, 20 days. Then we went for this ACS nano. They came with 30 days copper metal. So again, metal is coming here. Organic framework, nanoparticles stabilized with folic acid, improved wound healing in diabetes. Then we thought that let us try with our system. And very nicely we saw that it was okay. The FAR started growing even after at the 13th day. And we have done the entire histology, immunological assays to clarify, to give the proper thought process that why this diabetic wound healing is taking a lower time in our case. So monitoring of the diabetic wound closure in the Vista rats was performed in first, second, fourth, sixth, 8, 10, 12, 14, and 16 days. Here I have showed the images of 1, 5, 10, and 15 days. In treated group, wound healing was significantly greater on 10th day with respect to the control, indicating that hydrogel nanotubes accelerated wound healing in diabetic rat. On day 13, the wound of diabetic rats demonstrated enhanced recovery potential by 90%, which was greater than those in control group. The wounds in diabetic rats were completely healed on day 16, where in control group, the wound healing reached up to 80%, primarily from the panniculus carnosus mediated contractions. We did not observe any festering or hypotropic scarring at the wound site during the experiments, and the appearance of FAR was observed at 16th day. In control group, disruption of blood vessels, extravasations of blood constituents caused induction of coagulation cascades, manifesting the formation of biopolymeric plug at the wound site that primed the wound niche for repair. As the drainage capacity of the vessels was largely compromised, a consortia of inflammatory cells, including neutrophils and macrophages, was activated, which hinders the wound healing for longer time. The pro-inflammatory cytokines IL-6, TNF-alpha, is secreted by the macrophages are the major players or the game changers in the induction of acute phase response. Due to their superior biocompatibility, we sought to utilize our hydrogel nanotubes in an optimal local healing milieu. For the treated group, the hydrogen nanotubes encouraged a rapid migration and proliferation of keratinocytes at the margins of the incision in synchrony due to the new effect which we give, that free edge effect. The ampliflicity of hydrogel nanotubes favors an increased rate of reepithelialization following fibroplasia, which supports the production of ECM, that is the extracellular matrix compounds such as hyaluron, fibronectin, collagen, and proteoglycans, with accentuates endothelial cell sprouting and stimulates neurovascularization as observed at day 5 in the treated group, which you are seeing. However, this nano to micro hierarchical pattern HNTs play a profound role in controlling the wound moisture, absorbing exudates, space filing, controlling oxygen tension, wound bend restoration by forming a provisional matrix, as well as painless debridement and preventing loss of water, ingress of microorganisms, specks of dirt, and overall wound dehydration. So wound healing was enhanced in the treated rats with respect to the control because reepithelialization was quicker in the moist environment, which we know hydrogels are there. So what new? Question may be asked. So the answer to this question is we have a helical ice-like pattern inside the hydrogel nanotubes. So there is a frictional drag and the moist environment is there for longer time as there is a sustained release of water. So as corroborated, which is also corroborated by significant decrease in IL-6 and TNF alpha, a concentration at day 5 and in day 10 in HNTs treated diabetic rats. So the collagen margins were visualized close to the incision layer for by day 5 in the test group, and these ultra low biofouling HNTs prevented non-specific protein adsorption on their surface, effectively alleviating foreign body response and resisting the formation of collagen capsule around the material. So the HNTs may act as effective molecular sink, curbing excessive requirement of immune cells and thereby resolving the inflammatory phase quickly, as assessed by the significant increase in IL-10 concentration compared to the control group. So the HNT facilitated the formation of structured granulation tissue with high cellular density by day 5, indicating significant neovascularization, and the gradual decrease in TNF alpha and IL-6 by day 10 are related to the pro-healing phenotype, which promoted tissue remodeling and regeneration. In contrast, the control tissue displaced vascular insufficiency and limited cell requirement to the territories and delayed wound healing. So we believe that an orchestrated interaction of cells with HNTs at the wound bed synergistically improves the healing in the day 12. Thus, the inhibition potential of IL-6 and TNF alpha and a concomitant upregulation of IL-10 revealed the anti-inflammatory potential of HNTs, where low IL-10 prolonged the inflammatory phase in the control group. And by day 16, differentiation of surface cells produced a matured epidermal architecture, establishing a basement membrane and a dermis consisting of multiple layers of fibrous connective tissues. So this paper, this work which I described has been published in Material Horizon, which has a very high impact factor of 14.5, and this came as a cover page. And interestingly, after the publication of this work, it was featured in Hindu, and you see the group working here. We have not only the research scholars, we have the intern students, the Rohan and Sampath, we have the PhD students, Adiba, Aarti, and Ashish. We have another person from our pharmacology department, Amit Institute of Pharmacology, who is Dr. Satyendra Rajput. So this was published in The Hindu, and based on that, very nicely, Jubilant Biosys has came forward to transfer, and we are in the process of transferring this technology. So this is hydrogel nanotubes and exotic nanostructures containing ice helix in a helical structure developed by our group has found to quicken the diabetic wound healing. Complete healing of wounds was seen on 10 days, and no scarring was seen, and far growth at the wound site was observed. Then I went towards molecular self-assembly and drug delivery. Again, this will not work because I feel the audio system is not matched in that way. Anyway, so let me go ahead. So polymer patterning at the nanoscale. Then I went to see some of the papers again, that how the patterning is done in the nanoscale. Then I went for seeing the tailoring of this patterning with help of, again, metals are there. Iron, cobalt, these sometimes metals may develop the toxicity in the molecules. So why not go away from them? So these metals are intercalated in graphene and they are giving the polymer patterning. Then we went to see the first principle, where they have done the calculation with direct self-assembly of a colloidal Kagom lattice, which I'm coming for the ACS nano paper, which we have published with Janus and Kagom lattice, and that it was used for the drug delivery for the treatment of colon cancer. So polymer patterning at nanoscale using graphene quantum dots. So we have done the polymer patterning, but using nanofillers. And what were those nanofillers? Graphene quantum dots. So what are GQDs? Advanced multifunctional zero-dimensional fluorescent semiconductor materials. They are very, very important compared to graphene and others. Why? Because we have restricted the confinement of the molecules from the X, Y, and Z dimension, and they are zero dimension. Pronounced quantum confinement effect. They are very biocompatible, and they do not have, seldom they have toxicity. They don't have, we can say they are very biocompatible. Abundant age states, functional groups, unique properties, and photoelectronic using their confinement effect and age effect. Low toxicity, better solubility and surface grafting, high electric and thermal conductivity. So there were challenges. Now question may come that graphene quantum dots are there, then what new you have done? Yes, we have synthesized single crystalline graphene quantum dots from industrial waste. And the waste which we have taken is the molasses which people normally throw out, or they don't use it further. So we have taken the molasses, and it is basically the work we have done is zero waste technology with comprehensive utilization of the product. So we have done the hydrothermal reaction with that molasses, and it is template and catalyst free mass production, persistent photoluminescence with high quantum heat. So they are very photoluminescence material with high quantum heat. So this is the synthesis of the strategy which I have shown. And then this is the morphology. This is another, before going to the ACS nano, I should tell about the fillers which I have taken for patterning them for Kagom and Janus. So this is the morphology which we are seeing. And we see very nice, at a very lower concentration, they are dots, but when we are going for the higher concentration, they are layer by layer, layer by layer. So it's just like a mage grains, layer by layer. So they form J aggregates. And this is hexagonal patterns. We have symmetry points. So we say single crystal, because had it been multiple crystal, then you would have different diffraction patterns. And so using this and XRD patterns, we finalized that this is a single crystal graphene quantum dots. So we have done the optical characterization, which we have done the time dependent, normalized the spectra of the graph, and we have also done the excitation dependent spectra in acetone. So it works very well in water as well as in acetone, and it has very good photoluminescent properties. We have studied the cytotoxicity with the normal cells, with the cancer cells. We found that they are cytocompatible material. We have done the hemolysis assay, histocompatibility, and then we have done the bioimaging with the help of liver cancer cells. And we see that the HEPG2 cells are very nicely seen with the help of our graphene quantum dots. So I have shown you the bright field as well as the other images, which at 405 excitation, at image at 478 excitation with the help of certain filters. And this images shows that these materials can be used for bioimaging. Based on that, then our paper was published in Green Chemistry, that also came as a cover page. And I'm the corresponding author of all the papers, and my students are the first, second, third, fourth, fifth authors. Yes, of course, I got some help from outside Amity University, Dr. Bishwarup Basu, has helped me to do some of the animal tricky experiments which were not possible here because we didn't have the Hg2 cells. So we have included him as one of the author, and he's from the Cancer Research Institute from Kolkata. So this was featured as a cover photo of green chemistry with an impact factor of 9.4. So these materials can be used also for doing click chemistry with the help of SUFEX, can be used for cancer specific bioimaging. We are already doing that work. Targeted drug delivery for cancer, metabolic identification, biomarkers, imaging of non-protein biomolecules. This we have started because, as you very rightly know, or you may not know, so it is my duty to tell you that click chemistry, coined by Professor Barry Sharpless, who is a Nobel laureate for finding out this Sharpless epoxidation reaction, he came out with a new strategy in 2002 with the help of click chemistry for targeted delivery and click joining of two molecules without undesired side product. So I, being this pioneer of this institute in India, that Amity Institute of Click Chemistry Research and Studies, we are doing this type of synthesis to come out with some novel molecules which can be used, which can have functional multidimensional suffix GQDs. So then we went for the synthesis of with this graphene quantum dots. Now I'm coming to the ACS nano work. We have done with the help of again monomers and polymers, but here the monomer is DMA EMA. So it is an ester type molecule. Again, we are not using any cross linker and acrylic acid, and we found that the genesis of Kagom and Janus nanomaterials. So how what is the genesis, why we use these materials? Because we believe graphene quantum dots are harbingers of a paradigm shift that revitalize the self-assembly of colloidal puzzle by adding shape and size to the material design palette. Although self-assembly is ubiquitous in nature, the extent to which this molecular legos can be engineered reminds that we are still apprentizing polymer carpenters. In this quest to unlock exotic nanostructures ascending from eventual anisotropy, we have utilized different concentration of GQD as fillers, which you can see here, in a free radical mediated aqueous copolymerization. So extensive polymer grafting over the geometrically confined scape give rise to very high sophistication, and that's two-dimensional assemblies epitomizing the planar tiling of Star of David, forming a molecular Kagom lattice without metal templation, evoke a petrichor. So interestingly, with a higher percentage, see 0.3%, this is the Kagom, which I said, and this we have given that the planar tiling of Star of David, and this one is the Janus. So at higher percentage, GQD allows selective tuning of interfacial property of copolymer, breaking symmetry due to surface incongruity, producing exotic Janus nanomyceli. Herein, with the help of suite of characterization, we delineate the mechanism behind the formation of Kagom and Janus, which forms a depot of heightened drug accretion with targeted delivery of 5-fluorouracil in the colon cancer, which is validated by gamma scintigraphy. So as I told you, the morphological and chemical characterization, you see, Kagom is a Japanese basket. So we are seeing this type of arrangement with the help of TM results, HRTM results, and the SAED pattern as well as the FFT. So we have also done the core cell structure, that is XPS, because only with FTIR it is the valence cell phenomena. We have to go to the depth to understand the mechanism of formation of this exotic nanostructures. So we combined our XPS result with that. So these are the Janus formation of TEM images of the Janus formation. So acquiring control over additives, direct distribution with the local environment of nanostructures is which is superlative for designing responsive functional nanocomposites. The versatility of block copolymers to form exotic nanostructures with precisely controlled size, orientation, morphology was dominated by a debate of materials on community canvas, which sowed seeds for understanding the structure relations in synthetic polymers. To make design more a science and less of an art. Ensembles of polymeric materials have been fabricated directly self-assembly and engineering defects, although a high level of complexity exists with structural precision, which depends control on the polymer, and it remains really an unmet challenge. There has been concerted efforts towards achieving nanostructure with sub 10 nanometer, yet there is relative lack of directional stemming from structural multiplicity, lack of control, complex low symmetry topologies with demand the knowledge of target blueprints. So judicious fabrication of exotic nanostructures from block copolymers is the game of mix and weight, often blighting bulk properties such as processability, swellability, release kinetics, impending conformational flexibility. So the materials fabricated with precisely control of anisotropy, orientation, topology, molecular functionality, hierarchical self-assembly are still at their infancy in the polymeric material, where a versatile toolbox is indispensable to sail through these impediments. So low dimensional filler materials, that's why we have chosen, that is graphene quantum dots with their inherent large surface to volume ratio are particularly appealing to overcome these challenges, as they are known to facilitate an augmented efficiency uh, of innate properties. From a structural standpoint, nanoparticle have paving the way to engineering of polymeric materials. We demonstrate the potential to produce molecularly distinct structural conformation by using different filler concentration of GQD in 0.05%, we get a Kagom lattice, and with help of 0.3%, we get this Janus, that is the biphysics system. We get this biphysics system for this. Now, question may become, why we get Janus at higher concentration? Because GQDs are not GQDs at higher concentration, they form J aggregates. But at lower concentration, what happens? GQD remains as quantum dots. So they are properly intercalated in the polymer matrix. That's why we go for the Kagom lattice. But at higher concentration, we get the Janus membranes. So this has been seen. Again, we have also done with only, now question may become, okay, why GQD? Why not the polymer? Did you check with the polymer, neat polymer? Yes, we have checked. They are only giving rise to this polyelectrolytic complex showing the micelle, and they are not giving rise to exotic nanostructures. That means exotic nanostructures is governed with the help of graphene quantum dots, which is directing the self-assembly of these polymers, block copolymers, towards Kagom and Janus. This has been validated with X-ray photon spectroscopy as well, which I'm not going into the details, because if I go to the details, it is very difficult to finish. So it has been done, all the studies we have done, elemental, Raman features are also very, very important to go for the lattice phonons to understand the mechanism and what we are speaking, because until and unless we touch base with all the experimental data, we cannot come with the mechanistic insight that how these exotic nanostructures are formed. We went to the XRD diffraction pattern. We went to the depth to understand, and we are the first person to give rise to this sharp peak at 14.6 degree to theta, which we say that it is for the polymer cilia to give rise to the Kagom lattice. We have done the differential scanning calorimetry, thermogravimetric analysis, rheology, loss modulus, complex modulus. I'm not going into the detail because Bishmita has only given me Dr. Bishmita has given me only 1 hour time. So I have to finish within that time span. Mechanical strength, swelling release, drug loading. We have done the cytocompatibility. Based on that, then we went for the gamma scintigraphy, which I will be talking about. Since this is the image, you see the gamma scintigraphy we have done. This we have collaborated with DRDO. And one of my junior, I should tell that Dr. Amit has helped me to get this gamma scintigraphy instrumentation done. And Dr. Adiba, who is my research scholar, who has just completed her PhD and joined as a research associate in AIMS, has done this work along with other students, because I divide the work among the students and they do the work, and then we come up with a brainstorming session to understand the mechanism of this formation of these exotic nanostructures, as well as when we get good results in this application, we also go out to see that what maybe this exotic nanostructures taking part for this better application compared to others or the existing materials. So cytotoxicity, as I told you, was done, and this hemocompatibility and all of them has been checked out. And then we went for best out with this mechanical thermal stability, excellent biocompatibility, swelling release capabilities. We ventured to use these hydrogel systems or these composite hydrogel systems for targeted delivery of 5-fluorouracil in rabbit model via time-based gamma scintigraphy live imaging using TC99 targeted drug. And this level drug with fluorosil showed high leveling efficiency and stability both in sodium chloride and acetone. The meaning of leveling efficiency of 5-fluorouracil after 24 hours of incubation, which validated with the suitability of tagged drug for the in vivo use, the effort for accurately investigate the contrast between the free drug solution and hydrogel encapsulation drug distribution. Post administration, we passed uninhibited 5-fluorouracil control to rabbit model orally. The snapshot of gamma scintigraphy results reveal distinct traces of free drug control within the mouth as well as stomach. Rabbit at 0 hour of post administration on the see, you can see it is distributed everywhere in the 0 hour, you see in the mouth. And then it went to the entire system for the control. But in case of the control, the unaided drug had spread to the bladder, eyes, brain regions, indicating ill-defined oral distribution of free this 5-fluorouracil. At 4 hours of post-administration, the intensity of free drug has substantially increased in these areas, indicating the distribution of the drug. The hydrogels, however, swelled only slightly after 4 hours gradual moving towards the duodenum without releasing any drug. At 6 hours, drug loaded composites slide towards the intestine and starting release of 5-fluorouracil at alkaline pH. As the hydrogel was steered towards large intestine at 12 hours, it further swelled, releasing more drug. In contrast to free 5-fluorouracil, depicted this principle of the tagged drug throughout the intestine, bladder, eyes, and brain, making it prominent that by 24 hours the drug snapped the entire alimentary canal of the animal. However, its intensity was reduced markedly, suggesting that the major proportion of the drug was flushed out, compromising its bioavailability. Interestingly, the drug encompassed in the hydrogel sample, that is the PACD, that is the neat hydrogel, the Kagom lattice, that is the composite, Janus, that is again the composite hydrogels, did not follow a similar path and indicated and depicted sustained release via an active delivery system to validate the role of GQDs. Again, we have scrutinized, contrasted our hydrogel samples. The drug confined within PACT did not spread to the organs except the colon at 24 hours, and its intensity then came to some extent, as opposed to this PACT, the nanocomposite exhibited, that is the Kagom and Janus exhibited, indicated an escalation in the residence time of the formulation, and Janus plausibly induced mucoadhesion, increasing the intestinal permeation of the drug, where concentration gradient 5-fluorouracil rises steeply in the large intestine, increasing the oral drug bioavailability. The on-demand release and high level of control supported by gamma scintigraphic studies reinforce that our in vitro conclusion and proving their precisely predictable response with respect to stimuli. The sustained drug release facilitated the suprastructure, and the PACD in the rabbit model was confined to colon, where they encountered an alkaline pH and remained devoid of any burst release. So in this way, we have seen that the best release was done with the help of Janus, then Kagam, pad, and it was distributed with the help of with the control. And this was published in ACS Nano. Again, it went the cover page, and we see that again these are all from our department. Only Dr. Lalita Mehra and Amit Tyagi, who have helped us with this gamma scintigraphy. We have also incorporated their name. Dr. Dinesh Kalyan Sundaram from IIT, who has helped us to do the mechanical properties, and rest all are from Amity, and I am the corresponding author of this paper. So next, although the time is very limited, I will say that just yesterday we got our, day before yesterday rather, we got our paper accepted, which is emergence of heptazine-based graphitic carbon nitrides within hydrogel composites for scarless healing of burn wounds. Here, this time we have done 2-degree burns in the rat model, and we have seen that with the help of losartan in 2000, this work we have been inspired with the help of John Hopkins report in 2018 to use losartan, which is normally given to a blood pressure patient, so high BP, to control the high BP. So we have used this losartan for this wound healing, and we got very good healing with the help of our nanocomposites, where one nanocomposite is intercalated, that is the carbon nanosheets are intercalated, that those are not giving that good efficiency, but those which are again the tubular architecture with graphitic carbon nitrides inside pattern, where in the earlier case we saw ice helix, here it is graphitic carbon nitrides, because here the carbon nanosheets we are using as a filler, not graphene quantum dots, and carbon nanosheets are melamine doped, and melamine have that triazine molecules, and these triazine molecules, because of nano confinement with the help of Brock copolymers, give rise to the emergence of heptazine based graphitic carbon nitrides. And this is the first report that we got this graphitic carbon nitride at 40 plus minus 1 degree centigrade with the help of polymers, with the help of these monomers, that is that monomers are guiding. But if we do for this graphitic carbon nitrides, normally it takes very high temperature. So this will be the first report, and this is again accepted in ACS applied polymer materials with an impact factor of 12.5. And this is the schematic. This is, as I told you, the melamines incorporated in between the sheets. And this is the scheme. This is again the TEM images. We have got to the in-depth of the TEM and the indexing of the SAD to say that it is a graphitic carbon nitride. We have done the AFM topology to understand the composite's behavior. We have gone through the thermodynamics to go for the thermogravimetric analysis, DSC. I'm not going into the details against the rheology, mechanical analysis, the SEM analysis, the FTIR, Raman, XRD, XPS, and then again went for doing the histology and the immunological studies with the burn models. And then we concluded that it gave a very good result with the 2-degree burn. And this will be the first report to give such good healing with 2nd-degree burn with hydrogel nanocomposites. And the last, I should also mention, I'm not going to the depth. Again, we have published another paper related, because we are doing exotic nanostructures, so carbon nanomaterials to combat novel coronavirus. Can you do that? So we thought, let us use the click chemistry. So the rationale behind our work was the presence of sp3 hybridized carbon in CQD, not in GQD. Here, see, GQD cannot do because GQD have mostly sp2, but CQD can do because they have sp2 inside and sp3 core outside. So then they, when react with the surface in the surface functionalization with the help of trial, they give synergistic effect, and we develop different type of molecules based on that. And then these molecules were tested with human coronavirus sample. Yes, we have collaborated with NCL Pune, and we got very nice results. We have given a mechanistic insight. I'm not going into the depth of it because already the time is over. If you want, you can ask me. I can share the slides or the data with you, and the paper is already online. So the methodology for developing these molecules and the proposed route for the formation of CQDs with boronic acid as functional groups via click chemistry. We have developed 9 different type of bioisostars, and the outcome is that the work is published in Nano Today, which has an impact factor of 17, and all the authors are from Amity. And interestingly, Piyush Garg, who is a student, intern student, along with research scholars Sujata and Dr. Kaur has done this type of work in the lab to come out with this type of outcomes. So other work, this is sustainable chemistry and engineering. We are also working with nanomaterials for understanding the role of graphitic nitrogen for lipid production as well as biomass production. And in fact, we are coming out with a very good publication in ACS Nano where we are showing the highest lutein production using our nanomaterials, and this can be these materials are can be used again and again, so it can be harvested with the help of algae. So these are the some of the methods. We have also done some work on sensing. I'm not going. So my group, our department started in January 2016. Amity Institute of Click Chemistry. The journey started in this way. I got Distinguished Visiting Scientist Award from Royal Society of Chemistry and opted to work with Professor John Moses in Nottingham University. Right now, John is the chair professor of the top notch, which is rated #1 by Nature, and that is the Cold Spring Harbor Laboratory, New York. He has joined recently, just 2 months back. He's the chairman of our department. I'm the director. Dr. Shekhar Datta, the Ramanujan, as well as Ramalinga Swami Fellow, who has joined with his fellowship and will be working with us. And he's also given associate professor designation, but he's getting this fund from Ramalinga Swami. He did not opt for Ramanujan. Dr. Ranjan Patra is again the Ramanujan and DST Inspire Fellow. He's also working with his fund and joined with us last year. Dr. Vivek Mishra has joined just this year in the month of January, and he's the click chemist in our group. Then this is our lab facility. We have very good self-motivated students who work. We have top 10 CSIR students who are also doing very good work with us. To name them is Bipin and Sujata Sangam. We have very good infrastructure and learning process, which I got from DST, and I'm really happy and I'm thankful to Dr. Ashutosh Sharma for giving this facility to me. So one can see enjoy the access. The labs are as per international standards in Amity Institute of Click Chemistry Research and Studies. The research publications, I should mention that we have come with single author, Dr. Shekhar Datta in sustainable chemistry, ACS sustainable chemistry, chem sustainable chem, ACS catalysis, and energy and environmental science. So some of the cover pages, 4 patents are granted, total 12 patents are filed. Mostly are mine because most of the student faculties have joined last year, but they are coming out with very good publications. We have only 4 years, we have established the department. We have 6.5 crore of fund. Collaborators, as you see, Latrobe, University of Nottingham, John Hopkins. Of course, I forgot to add, I should have added Cold Spring Harvard Laboratory because John has joined just as a chair professor. Dr. Ranjan Patra, within his 1.5 year work with Amity University, with Amity Institute of Click Chemistry, has been mentioned among the emerging investigators in crystal growth and designed by American Chemical Society. Miss Aarti's work is featured in Hindu, and based on that, we are getting this technology transferred to Julian Biosys. Achievements of AICCR students, Rohan Bhattacharya, intern student, got these papers and got 100% fellowship, and now he has also received pre-NIH grant, pre-doctoral NIH grant from Duke University, which is the one of the which has 5%, which is ranked among top 5% university, and he's working with Nusha's lab for design of organ in a chip. Dakshi Kochar, she's also published. Hopefully, she's coming with Nature Nanotechnology because our paper is in second review. And Dakshi is the again intern student. She got to do her MSc in Carnegie Mellon University. Sampath Jivanananda, he went to do his work as a PhD scholar in South Korea. He's a nanotechnology. He was a nanotechnologist in our group, still in collaboration with us. This is just a view of our biotechnology lab because I have a lab set up in biotechnology and 3 labs in click chemistry, and the entire half a wing of J1 block is our click chemistry department. And at the last but not the least, I believe the phrase of Professor Chauhan, when God pushes somebody, inspires somebody, leads somebody, no power in the world can stop such person. So if you have aim, you can do work from any place. It doesn't matter. It is IIT, IISc, or if you have aim, you can do better work than them, but you need to be a silent worker. You need to struggle hard. You need to be focused in your approach, and you should maintain the 3P. That is the passion, perseverance, and patience to achieve your goal. So the acknowledgements, Department of Science and Technology for giving me the core grant of 50 lakhs, Department of Biotechnology for again giving me the core grant of 48 lakhs, UGCDA again giving me the grant for doing such type of good research along with the RRCAT Spintronics facility to the student to go and pursue their work, and of course Amity University for providing research infrastructure, self-motivated research scholars and intern students, and thank you. So Bismita, I took a little more time. Very sorry.
No, not a problem. So I believe we are highly fortunate to have you. It was indeed a very nice, informative presentation loaded with many information. I must congratulate you for your recent papers in such a high impact factor journals. So very congratulations to you having a COVID, COVID paper, that too in ACS Nano and Nano Today. So these are some of the high impact factor journals. I just dream to have one at least in some time. And Taking on the question, so let me inform you that there is a power cut at NIT right now. So
Oh,
so there are the students and the faculties who
okay,
were
okay,
joined with us. So
okay,
now they
okay.
are actually disconnected. So
No problem. No problem.
actually, Dr. Rohan
Whenever
sir, he has
whenever
already
questions
informed.
are there, please do let me know. I
Yes,
will be
yes.
happy to
So I
answer
have
them.
questions actually
Yeah.
in the comment section, because some questions are already there
Yeah,
from
please, please.
the YouTube channel. So
Yeah,
we'll
please.
be taking on those. Just I have taken the screenshot just to
Yeah.
question you. So the first question and the second question is coming from Prabhat Kumar Swai. He is asking, what are the materials used for fabrication process in your study?
Materials.
Yes.
Materials. What does he mean? The
So
study
maybe
material?
he is asking for this polymeric
Yeah,
materials,
yeah,
how you are
yeah,
amalgaming with things,
yeah,
and are
yeah.
they more
I am
compatible
using,
kind like?
I am using acrylic acid and DMA, EMA and DMA, PMA. These are very known monomers, and some have this amide linkage, some has this ester linkage, and they have NMEME linkage, that is the nitrogen with lone pair. And since we are using another monomer, that is the that is the acrylic acid, so this acrylic acid has carboxylic groups. So this salt formation is very easy. So we this is again tailoring for the cross linking, and we don't need any cross linker for that. So these type of monomers we normally use, which are water soluble. And of course acrylic acid is very important for that, because if you take in higher amount of acrylic acid, that is guiding towards the hydrophobic and the hydrophilic part, and that is also giving rise to the block copolymers. And we do very facile technique, that is the acrylic, that is the aqueous copolymerization, and with the help of initiator, and with the help of say accelerator and initiator, which normally people do, ammonium persulfate or sodium persulfate, that's all about, and 40 degrees centigrade. These are all I learned from my alma mater institute, seeing Dr. Anup Das, seeing say I forgot that name, he was RA with us, Dr. Can you remember Bishmita, Dr. Who is in now Jharkhand?
Jharkhand, I exactly don't
Dr.
remember,
Day,
but
Dr. Day, Dr.
Acha,
Day,
Dr. De. Okay,
Dr. Day.
Dr.
They
Ratan
used to,
Kumar De.
yeah,
Okay.
they used to do this polymer synthesis, but they never looked inside the molecules, that what it can be and how you can go for mechanism. Because my dear students and friends, if you don't go to the depth, these high impact factor papers are very, very difficult. And I tell you, I am not a biologist. Dr. Bishmita knows very well. I'm an organic chemist, but I learned biology from my self motivated students, and learning that. And my student questioning, no, ma'am, you are wrong. I think this way it will be right. So I like this type of students, and that really helped me to come out with good results. Yeah. Next.
So, second question, he is asking how to produce biopolymer plastics and what is its market value?
Biopolymer plastics is another important arena, although I'm not working on that. For that, you need to have a proper choice of monomers. Say you go for thermosetting, thermoplastics, you see what are the polymers used, maybe acrylonitrile based, maybe they are also using vinylidene polymers, and that can lead to your biopolymers. Or you can also, that can lead to your polymers. Also you can go from the waste, that is the bio waste. Suppose you can go from the potato peels, you can go from some other waste, you can grind them, you can use them as a filler, used in the with the help of with this aqueous free radical polymers, and you can give rise to some type of bioplastics which will have very low toxicity. Of course, graphene quantum dot can also guide this type of biopolymer formations.
So one more question. I think there are few, but we'll take on the most important questions first. So he is also asking, what is the proportion and composition of nanocomposites? How you mix together, and what are the
Yeah.
things you take care
Yeah.
for your studies? Like if you have many things, like how you make the
Yeah,
composition
very
right?
good, very good. So always nanocomposites, for making the nanocomposites, it is always desired that the nanofillers, that is the nanomaterials which you take, it should be less than 3%. But I always keep the concentration that around 1%, not more than 1%. Why? Because the mechanical properties are lost. It is not like that, that if you go on adding more filler, your mechanical property will be high, because it depends on the type of the filler, that it will be a soft gel or it will be a hard gel. So the proportion which we fix is 0.05% and 0.3% and less than 1%. That is the proportion, and we mix them in the with the in sonicator along with the monomers, and then we go for the polymerization. So we mix them one by one. First we take the nanofiller in water, and then we sonicate them, and then we mix with the help of one monomer, that is the which we are taking in a lower percentage, say DMA PMA or DMA EMA, and this DMA EMA then try to exfoliate these nanofillers, and then go for adding the polyacrylic acid, then go for adding the acrylic acid which we are taking in higher amount, that is the 70% and 30%, and do the reactions.
So, if I at all can take one more question, just a brief out, if you can just simply answer, what is the importance of a hydrogel? Like, I think it's a hydrogel encapsulation in drug delivery. Hydrogels we directly use for drug delivery purposes, but
Absolutely.
then there are some things where we also encapsulate again the hydrogels into different
Yes,
components.
yes,
So, what
yes.
is its importance, and how long it can be, the duration or the shelf life can
Yeah,
be decreased?
very, very good question. Hydrogels can have a sudden burst. Hydrogels can have a sustained release. That depends on tailoring the reactant molecules. So if you take the percentage of the starting components of the two monomer in a particular ratio with the amount of water, which is the media for reaction, that tailors the cross-linking density. And that also goes that if higher the cross linking, it doesn't mean that you are going to have sudden release. And the morphological aspects, if the pores are throughout the system, then it will be a sudden burst. But if the pores are in the top and below and throughout, in they say in the surface, it doesn't have the pores, then it will be a sustained release. So based on that, your release pattern, how you want, these hydrogels can give. Yes, hydrogels are very important. And so these hydrogels, as I showed you, don't need the graphene like materials. With these graphene like materials can be prepared with the help of acrylic acid and DMA, PMA, which I showed you. We have hexagonal patterns and the structured water, which is giving rise to the ice helix pattern. So these have very good implications as you go for drug delivery, for sustained release of drug. Now, for sustained release of drug, sometimes neat hydrogel cannot work. So you need a composite material for that. So proper choice of nanofiller, making the nanocomposites, that can again go for making these exotic nanostructures, and these exotic nanostructures with unique features can go for very good drug delivery or wound healing or burn, second degree burn healing applications. So hydrogels are well known. See, their hydrogels create moist environment. Then what new with the hydrogel nanotubes with ice helix? That is because of this helical pattern, there is a frictional drag. So entire water or the moist environment is not lost at a single point of time. It is sustained release. So The release is sustained because of this helix. There's a frictional drag. So the choice is to create a proper exotic nanostructures which can help you within hydrogel. I'm not going other from hydrogel other than from my this coronavirus work which I have done with carbon quantum dots and click chemistry, that is the triazole functionalized. So that is different, but other for drug delivery, wound healing, burn healing. So hydrogels only cannot work, but hydrogels with exotic nanostructures or nanocomposite hydrogels can do a better work.
So I think people have joined, our faculties, they have also joined. I think Dr. Surajit Das is also here. Dr. Surajit Das, if you can hear. Dr. Surajit Das. Yes, now you can see him. Yes. So I think
it was a nice talk. Although I missed the initial introduction and the starting because I had a class from 9 to 10, and later on I joined. Then there was a power cut. Finally, I rejoined.
Yeah, sometimes it is very difficult to have
Very
things in
difficult.
your control.
Although we have backup, but for a couple of minutes or around 5 to 10 minutes, we need to wait to reconnect the internet.
Hope I have tried to give some insightful.
Nice to see you, Monadi, and a long time.
Yeah.
Although we are in touch over phone, and we're pleased to hear your talk. And it is our pleasure that you have agreed to deliver your extraordinary research in this platform. We are really thankful to you. It would have been our great pleasure if we could invite you personally to visit our campus. Hopefully, in future, we'll be looking forward to host you in our department.
I don't think Dr. Monalisa would ever deny for that.
I would love to come.
Yes. So we'll have
not only to Monalisa, everyone, all the speakers. This is the I think fourth series of this webinar we are conducting sequentially, and all the speakers actually we basically love to interact in person when the researchers come over here, and we take them to visit our laboratories. Although we have a very tiny laboratories and a very minimum setup we have, but still whatever we have, we are proud of that.
It doesn't mind, Dr. Dash, it doesn't mind. You know, all this work I have done with a small room. It was very difficult.
I know. I know that.
But now, since I got this click chemistry department.
Now you might have got the new building and all.
New building and
The small AIB setup I know. When I was there in 2008 and 9.
You know.
So I have seen from where you started.
Yeah, but
you
now
started from scratch. And now you have become a macromolecule. So you started with nano, and now you are the macro.
Thank you so much.
Giant. Rather, it will be called a giant molecule.
No, I am trying to contribute in a very small way. But yes, Dr. Surajit, I try to inculcate this in people, in faculties and students, that no institute is bad, no students are bad. It only depends on the passion.
No, there are various enthusiastic students in our batch, in our department. They may be interested to work with you if you will kindly allow them to the short training for 6 months or maybe a shorter of 2 months. We will be really glad to send our students. They are very, very brilliant students.
And Dr. Surajit, you know, Dr. Bishmita and you are very close to my heart. So I cannot stop anybody from there to come and do the work. Thank you so much.
Thank you so much, Dr. Monalisa. I think everybody who has joined us for this session, they have thoroughly enjoyed and listened to your talk, and probably they have something to take from all your slides and understanding that you have given throughout the session. So again, over to Dr. Rohan Dhiman sir, if anyone else wants to interact, or maybe he can take on and just.
Okay, thank you. Yeah, thank you, ma'am, and thank you, Monalisa, ma'am, for a wonderful talk. I wanted to, also be present, during end part of your talk, but due to power outage, as Surajit sir has already mentioned, so it was a little bit late on my part to rejoin back. But thank you once again for sparing some valuable time and sharing your wealth of knowledge with us. And hopefully, I think so through this platform, which is through Zoom or through YouTube, many of the many of the our participants must have been benefited. And thank you once again, ma'am. And we love to see you once again. Thank you. Thank you, ma'am.
Thank you, Dr. Rohan. Thank you. Thank you for your
Thank
kind
you.
words. Thanks to all of you. So, Bishmita, Dr. Bishmita,
Yes.
can I disconnect for?
Yes. I think you
Yeah.
can.
Because I have some
Yeah.
administrative work. Again, I will join within 1 hour. Right?
Okay. Thank you. Thank you so much.
Thank you so much, Dr. Bishmita, for giving this opportunity.
Thank
Love
you
to
so
see you
much.
in person.
So
And
it's
my best wishes to you. Do very good work. Okay.
thank you so much.
Thank you, ma'am.
Thank you.
And thank you, Dr. Shurajit, also.
Yeah, thank you.
So I think so now, as per the schedule, we are moving ahead, and now it is my pleasure to introduce Mr. Ajit K. Mahanta. I think so. He has already joined with us, and I will request Mr. Mahanta to
Mr. Mahanta,
on
are you
his
here?
microphone and video.
Yeah. Hello, everyone.
Okay. Thank you, sir, for joining with us. And
Thank you so much.
I take this opportunity to introduce you. And as per your current experience, you have more than 14 years of experience in healthcare across pharma, medical device, and equipment and digital healthcare, and in various segments or in markets, and has been involved in several initiatives like Smart City and Smart Village project, Fit to Fly initiative, and also for ensuring the health insurance or smart hospital. And currently, I think so, you are working for your own healthcare startup. And prior to that, you were working in Alcon Laboratories, Genworks, Allergen, Zydus Cadila, Nicholas Pyramid in various positions in marketing, sales, and business development. After pursuing your bachelor's, you did your master's in business administration, and you are also a executive member of IM Bangalore and a business consultant. And with your young entrepreneurship mindset, you are also looking at every problem as an opportunity. And now setting up your own healthcare startup, you are collaborating with many doctors, and at the same time, you are also consulting other startups for their different for your different ventures. And as far as this conference is concerned, which Biswata ma'am is organizing, so your expertise will be really beneficial. It will be fruitful for us, because when you follow a pattern of that is called as bench to bedside, so there will be many different platforms which we have to encounter with. And I think so marketing, sales, and managing the health ecosystem, that is also one of the important aspects. And we are really thankful to you for joining with us. And we are all eagerly awaiting for your talk and entitled Digital Health Ecosystem. So, Mr. Mahanta, please.
Yeah. Thank you, Dr. Rohan, for a few words about me. And as you said, every problem has the opportunity. Yes, it is. But dear visionary is important. How you look the problem to giving a solution to this world or healthcare or anyone. So, am I audible, everyone?
Yes, sir. Yes, sir. Yeah.
Yes, you are audible, but I think a little bit glitch is there. Like if you can just hold on the mic or something, maybe some background, little bit noise is coming up. If you can clear that.
Okay. Is it okay now?
I think it's coming from the phone, but I think it should be okay. Yes.
Screen is, you can see my screen.
Yes.
The screen is there. Yeah.
Thank you. Just I'd like to inform you very fast. I'm on the way to hospital. Somebody from my family 2 days or 3 days back got spinal cord broken.
Mr.
So I'm on the way to
Ajit,
hospital.
Mr. Mahanta, just hold on. Again, I can feel some kind of sound. King is there, so it's not continuous, and maybe you need to either use the microphone or maybe some changes you have to make from the disturbances are there, not from the background of the place. It's coming from your
Maybe from internet and yeah,
from the internet or something.
some signal issues.
Yeah, I'll do it now. Just give me a moment. Let me clear it up.
Yes.
Is this clear now?
I think we can manage, but I think we can manage, and you can go ahead. Anytime I will feel, I will just stop you and maybe correct you. Please go ahead. We can start. I think we can bear with this much, as we can see you are outside. Yes.
Thank you so much for Life Science Department of NIT Rourkela giving this opportunity to talk about health ecosystem in our purpose. It's a digital healthcare completely. You all do clinical research, but I do market research. That's the difference between you and me.
Mr. Ajit, sorry to interrupt you again. I think if you can just remove the microphone, that would be nice. Somehow it's not coming well. Like there is so much disturbance that your voice is not clear. That's why. Maybe you can just put the earphone if you have. That should work fine. Yes. Directly when it is taking, it is creating a problem. Otherwise, I think if you use the microphone and or a earphone directly and speak to the speaker, I think it should be fine.
So, ma'am, Mr. Mahanta will be joining back again.
I think he has joined, but he has some issues because some of his relatives, she is into hospital. She went down and she has a backbone injury, like she is into ICU. So he is actually waiting outside. So she has there is some network issue or maybe like connection problem somehow. So probably he will be joining. Let's wait for some time. Yes, I think he's back.
Sir, can you unmute yourself? You please unmute.
Please unmute. Yes, you can keep the video off for a good internet connection. Just streaming takes a lot of data. So you can just keep the video off and you can give the presentation, and maybe later on we can talk.
Okay. Hello. Hello.
Your voice is too low.
Hello.
Can you hear me now?
So are you speaking? Actually, we are not able to hear you properly. Mr. Ajit, slides are moving, but we don't hear you.
Now I can hear.
Yeah. Now it is
Yeah,
fine. Yeah.
fine, but a little bit louder, I will suggest.
Okay.
Yeah.
Fine. That's fine.
Okay.
Uh,
Okay.
Sorry for the inconvenience caused. Maybe a network issue. I'm on the way to hospital. Not a problem. Okay, let's talk. So, well, thank you, sir, giving my introduction. It was very nice words about me, and I do believe every problem is the opportunity line, but how you look forward and giving a solution to the world, that's different matter. So, my outline today, I'll talk about the purpose and platform. Everything a purpose we do, personal life or professional life, but we need a good platform, sustainable platform to prove it. Then I'll talk about drug delivery in digital era, the new era for drug deliveries, and few devices required for drug deliveries now. What is market requirement now? And I'll talk about digital adaptation. I'll talk about digital screening and creating ecosystems. How much you can screen, you can diagnose, and giving treatment again follow up for the patient, and talk about opportunity and demand calculations. And last but not least, I'll talk about some good to know few facts in the real scenario where the ground clearance and ground report and reality are different in healthcare. With this, I am Ajit Kumar. I'm here to because I love to connect people, and you can connect me with ajit.mahanta17 @imb.ac.in, and my mobile number is here. And today we'll talk about digital health ecosystem. So first, we'll talk about the purpose and platform. So I know this is a lot of students are here, maybe in YouTube channel.
Mr. Mahanta, can you just raise your voice a little bit?
Yeah, and you can hear now?
Yes,
Yeah,
that
perfect.
this much is sufficient. Yes.
Okay. So in digital health ecosystem, definitely everything we develop, there's a purpose in ground reality to design thinking to make it product and proof definitely a platform. I'm giving example here, ECC in tier 3 city in today in India is difficult, but this digital era, if you'll see the picture, it's hub and scope model, we made it. All ECG machine are placed in village, rural areas. Data goes to directly to ECG machine to command center of in metro cities, and interpretation happen coming back again. Everything happened within 1 minute to 5 minutes, and we find out which patient is what. This is the purpose. Find out cardiac problem of a particular patient and giving a solution within 5 minutes, wherever it's needed. And health system ecosystem, it's lying. If you see the circle, it's a screening, diagnostic, treatment, and follow-up. And for that, before going to any digital platform, I'll let you know you should must aware about the policies. And if you don't know the policy, different department, you should know everything what exactly you're doing. In policies, we have DISA law, Niti Aayog, and every country basis. If it's a global product you're preparing, you should know the global. You should know the country basis the policy, central of government policies. Then every state have their own policy. So you should know all policies. Now we'll talk about the drug discovery in digital era. You are all discovering all drugs, how maybe from starting to ending. Now the x-axis talking about the expectation of drug preparation in your stage, and how when coming to in y-axis talking about the time taking and how you can prove it in digital eras. When talk about innovation trigger in a mind, it's put into design thinking ways. Again, redesign and think once again. Maybe 3 to 4 times redesign thinking and conclude what exactly you're going to do that. Before that, also before preparing a drug, you can find out how many drugs are available in substitute to this drug. Calculate the demand. I'll talk about the demand in the next slide or next slide. Then put into virtual realities. Lot of softwares are available or platform are available. You can find it or you can connect me. I can guide you. Many virtual reality, augmented reality, and mixed reality, and giving you what exactly going to prepare. See it on the eye in virtual. Then put into, if you're not finding proper support, you can suggest, you can take help of a lot of artificial intelligence support. It may be picture, it's maybe color coding, it's maybe anything, and make it more relevant what exactly to your connecting your purpose. And then last not least, we are going towards the production level now, which is precision medicine, then real world evidence. When talk about real world evidence, it's you are in between now. You are the mother who is going to be produced the drug now. Opposite side, the baby come out, which will be giving a solution to the world. It's like in between you are now. Now, if you the slope, it is slope of enlightenment that will be giving to the new drug to the world. It's a remote randomized control system trial basis. You do it. That's available now. In future, if you go to study clinical studies or people all do marketing research or clinical research, before you used to do sampling method or in vitro method, different method use, but now you can use it remotely recommend and control trial basis also you can do it. Now connected therapeutics, different therapeutics are available, different part of global, you can connect virtually, you can suggest them what exactly going to do now. Now, one second, your all trial phase over. Now remotely you can monitoring therapeutics, those are using your drugs, remotely you can monitor them, what's going to happen. When remotely monitoring, I'll talk about the screening devices now. Every patient or whom, wherever you are giving trials, you should have a record from starting to injecting a drug to body to the end, and every hour, what is the threshold, what's supposed to be, just track it. Everything available in this platforms. Now telemedicine comes to the last on this that I'll talk briefly. Like side, what exactly the world looking forward when developing a drug now. So definitely, if you this first one, A, B, C, D. A is definitely you have seen from my grandfather to father labels, there is an injection or any IV form or tablet form, any forms, like simple drug deliveries used to be happen in physical ways. Now, what exactly you as R&D point of views or a clinical research point of views, we enhance the result. Devices need to be changed. Series now device series going to change, like delivery system or particular year drug or prepared has to be changed. Now third, you can see it's a connected Wi-Fi model or Bluetooth, or you can say other connectivity to cloud systems or your own servers. Then third, not least, when there is a many devices connected to your drug delivery, starting from your drug delivery to end or delivery of the particular patient or particular drug, or you are giving mixed drug to this patient, you have to be having data. Now putting data into different way, writing somewhere, putting into Excel, then putting analysis, not really required. Now your device can connect it to system that giving wherever you are data that's this is a drug reaction going to happen, and this is starting time, this is the end time, this is threshold time. You got everything. This is a new era. I hope this will be helpful and inform to all students to be innovate. Our collaboration required to the IT teams, your college, life science or computer science students or mechanicals, or every team has to prepare this kind of innovation that will be helpful to them. Now talking about lot of digital. I mean, I'll give the serial scenario. When I started join in 2006-7, my first job, when talk about digitalization, people will be hesitate to talk with you. what you talking, maybe not right time to know. In 2007, what we study find out more than global research or India research paper, there is a 9% hospital used to be EMRCs, and those are like big giant. Now, in this scenario, there's 90% hospital or clinical systems of the country or global, they use effectively, not only they have used effectively, they use routinely EMR, HIS, EHIS, MHIS, different system they use, find out completely, monitoring systems. When talk about monitoring system, I'll talk, giving one example. All of you, I do have a car, everybody having a car, right? When you are coming back from the last hospital, when you are, gone for your father, mother, somebody else, when I don't remember when I got a call from hospital that you came from the hospital for different disease, you may be problem with the different disease because of his blood sample report. I never get it, and hope you guys are also not get it. What that means, hospital are not bad, system are not bad, but thing is that only we have not provided the ecosystem to find out what is the problem, why they are not connecting us. They don't have much connection. Bank is giving SMS, bank is calling us, service center, car center calling us, because they have ecosystem completely starting to end. But we do not have. What's the right? This is the right time if you provide the ecosystem from drug deliveries to uh, to whatever system you, delivery system preparing or anything preparing, it should be compatible with EHR systems. And again, the monitoring part will be very, very easy. That's opportunity we do have actually now. Now we'll talk more about the health screening part. This is the ecosystem starting now. We'll talk about ecosystem, why in screening, diagnostic treatment, and follow-up. Why this is more important. If you'll see this picture, there is a different devices. We have temperature, we have blood glucose, ECG, stethoscope, then we have BP parameter, then you have lipid profiles. There is a 30 to 35 point of care devices are in a single box, and it's connected to mobile app, which is we have tab here, and wherever you are screening it, you're getting a data lifetime. It's connected to physician or clinician wherever they are. Real, if you'll see the number of physician or clinicians are in this country are very less according to the population. We are on the population of India. This tool, this kind of tools, if we can prepare it for different disease, or you can prepare different drug delivery system with preparing for screening particular disease for that particular drug, this is going to help. I'll give example. In 2017, we have embedded different system like this. I was a business development for taking advice from the clinicians and talking with the IT team what exactly need to build it. And this virtual hospitals, we set off for talk about Apollo, to care for the hospitals. They have command center in Hyderabad and Bangalore. They have Hyderabad basically and mini command center in Bangalore. We do have around 500 to 700 center in tier 3, tier 4 center where the only nurse is sitting. And they are finding, and every day one person is carrying this device, going to village, doing medical camp, screening it. When the screening it, all parameters, when talk about not only the BP, this is very normal, diabetes, you can found every corner now only of the village, rural, in the population. When talk about breast cancer, talk about cervical cancer, it's really required a mammography to physically go to hospital to screen it. But you can do it now on their doorstep and find out either they have initiated in the body the breast cancer or cervical cancer, and you can report it to hospital on the same time. This is the beauty of screening devices. When you're screening it, automatically data goes to the cloud and you can find out the scale, normal and abnormality. Suppose you screen more than 1,000 people, you can find out how many are abnormal. Again, in abnormal, what type of abnormal now? It's maybe cardiac, it's maybe cancer, it's maybe different kind of things. In the previous talk, Dr. Monalisa was talking about the wound management, clinical point of view. I'm talking about now screening point of view. We have device called wound
A
screening
little bit
device.
louder, Mr. Ajit. I think
Okay,
again your pitch has slowed down, so that's why I'm correcting you.
okay,
Okay.
no problem.
Thank you. Thank you.
Okay, thank you so much, Dr. Bismita. So we talk about Dr. Monalisa was talking about clinical point of wound management systems. Now, any patient, whether it's a diabetic patient or it's a born case, any wound coming to hospital, taking culture and find out it's a gram positive antibiotic is supposed to be prescribed or gram negative. It's a difficult task because it takes 48 hours to 72 hours. Find out what kind of culture report is coming up. But the screening device is within 3 minutes, 3 seconds to 3 minutes after taking the picture, will tell you what antibiotic going to prescribe. So which is better and better to the for the patient. And this screening device is remotely you can put it 60% population, as you know, live in village and tier 3 to tier 5 or village levels. And it's find it normal and abnormal dashboard suggesting further treatment. And talk about manage chronic disease and primary stage. When talk about chronic disease, it's a good that have an opportunity for all of you to find out new drug for them, what kind of chronic disease coming out. So I'll talk about a little bit more about the screening, diagnostic, treatment, and follow-up point of views. In this scenario, in April, collaboration of IMB team, all the doctors from pass out from IMB, and we market people collaborating with all state board, starting from the health minister, to health secretary, maximum. We collaboratively work how to screen it and how to give me forecast. For tomorrow, how many COVID patient I'm expecting in my hospitals. That calculation data we have did it for them. And first state is Kerala has controlled drastically. It was hosted and became, they control very manners. And our COVID warriors are really given the more data in screening phase, putting into different kind of data. In that time, you will not find most data, but in social media data, we'll talk about a lot physical screening point of views from airport to home, from Anganwadi Kendra, pull out all data, given given report tomorrow how many patients are plus minus few deviation, they exactly get the number of patients. So tomorrow beds are ready for the COVID cases. So any kind of pandemic tomorrow is coming. We should be ready for the screening devices, and with support of yours, we can develop the drug as soon as possible to understand what kind of virus it is. And again, the lab test is only option available now for COVID. There is a kit available also, but again, the accuracy is too difficult now. I mean, to accept it's too difficult now. Again, the treatment phase, you have medication or you have the patient need to be added in ICU for longer time of videos, and indication need to be follow-up stage. I'll talk about more into these things, like cancer. I'll talk about in cancer, there is a different type of cancer. Let me talk about giving example of breast cancer and cervical cancer. So breast cancer is the only option. Patient has to be go when they're getting pain in hospitals, and maybe in stage 3, stage 4 in operation stages. And if you see the data, not a patient that die or giving like gamma ray or other treatment, very painful treatment in the last stage. Why we cannot find in screening stage? We have a device now, collaboration with Israel and UK. The device can put your body, and it's a small device, small round device. You can put it and can find out. It's a Bluetooth and cloud-based data pushed directly to your cloud-based and find out either there is normality or abnormality. If it is there, definitely go for mammography or the treatment, medication or surgery point of view. If you screen that stage, it's at health definitely required a approval for the state governments, every state governments, and they screen it properly to the population of districts or state. I guess will control this disease like anything. Same thing to cervical cancer. We have portable devices. This colposcopy device we can find in gynec hospitals is too big. You cannot move to one place to other place. But this device is equal to the small mobiles, and you can take a picture. I can find out the abnormality stage in cervical cancer. and it can save life of many women in early stage of detection. This is the power of screening tools in IoT devices connected to different cloud versions. And we do have screening more than 30 to 40 point of care in a home's doorstep. We can screen it and find out many diseases. And wound management, Dr. Monalisa was talking, again, had a talk. Then BP, glucose, asthma, and many diseases are coming us. Or TB, you can talk about TB. I got a village last 2 months back. There are 50 to 60 people died because of TB. So I suggested to state district collector, why not you taking initiative to control this? I think this month they are taking Kenta screening for the districts, and that is very easy. And we can take initiative in the ground levels and control these diseases. Then we talk about little opportunities. Now here, how you calculate the demand. What I heard today talk until today talk.
Mr. Ajit, so you again you maintain your voice, so that would be
Okay,
nice.
fine,
Okay.
fine.
Yeah.
So this is a good slide. I'll talk to opportunity all of you. All of you, I heard more than 5 to 25 to 30 patent having, or you guys are having patent, but you are giving to some pharmaceutical company or the national board to use prepare the drug. Why you guys are not coming off to calculate demand? How to calculate demand? I'll tell you the need into willingness and affordability. So you can start your own startup in particular segment. So you understand our purpose, set a particular platform which is sustainable, and you can start your need. Definitely you have prepared dog. Maybe definitely they have substitute in the market. Definitely they have this new molecule to the market. And how much willingness people should know this is a new drug. Definitely, I'll give example of moxifloxacin when came to market. It is a new molecules, right? From different company came to, then lot of moxifloxacin are available in the market. But you guys, somebody having patent, and everybody has taken from this patent from particular company, and that patent definitely somebody like scientist you, they have invented this drug. Why not you coming with different drug and make it affordability? Market size, what market size? Maybe particular disease or particular segment completely, or it's combination of uh, drug. You can add it here and get into market. This is the biggest opportunity when it's chronic disease coming now. If one patent or one drug can make you world healthy in particular disease, that's the purpose. I'm not talking about how much money coming to that secondary part. And the platform, it has to be sustainable and has to be a digitally connected platform that will be more adapted in B2C segment or B2B segment, whatever segment you are choosing to be getting to the market. Definitely, whenever coming to B2B, it will be easy for all of you fast. Then if you want to larger scale, you're getting good investment, definitely go to B2C market and start your own organization. It's like pharmaceutical or medical devices or equipment companies. And medical devices, what last you can see last era and this era completely digitalized everything, and everything coming digitalized in future. So that put into mind, and if there is no market willingness to buy it, so definitely we have to create a lot of awareness. Want to talk about awareness in this era, the digital marketing, we talk it out, or talk about influence marketing, somebody using, talking in the different podium that sell your drugs. And you can keep it affordability, that's up to you, how much you can do it actually. But need, again, I'll talk about need a little bit. So we talk about need in going to hospital. I'll talk next slide also, how the need and want you can create it. Want, definitely patient want particular drug for this disease. But how we can create that need through the doctor or through the clinician who's treating this patient, that's really matter. So this will be different want and need. So all the students should understand it, and in near future when coming out your own venture or something else, or supporting state health, government or government health, you should understand this one and definitely go to success. I'll good to know when you are all going to particular hospitals, setup, you are into other side, you are all developing the drugs, and other side is user base. Now, if you go to particular health setup, we need to understand what is health system. In many companies, if you see, it's a good drug, but people are not using. Clinicians are not using. Why? How to get into this drug in different, healthcare system, provider. So if you go to particular hospital, there's 3 departments. I understand them very nicely. One is clinical. Basically, those are doctors, staff, the technical staff, or who is advisory board. And definitely they follow some R&D papers. They follow a lot of supporting documents. These are the one side. Second side is health IT. The IT team, those are providing the softwares, different IT infrastructure to this them. And if you this both clinician IT, definitely doctors are never much understanding on technical point of view what IT support they are providing us. Or IT people never understand much. I'm not saying that they are not understanding, but definitely they understand. But human clinical point of views, really there is a required lot of knowledge to be shared with technical team. And same time, when come to in administration, your biomedical, your purchase, your PRO team, counseling, sales, marketing, other things, they are providing what they both are need actually. Now, here the game changes. Either you have to consult with doctor what kind of need, what exactly need for the hospitals. Maybe it's equipment point of view, it's a different drug point of views. Lot of see the quotation coming to the for the on the end of the purchase. Where you need to see how you need to highlight your drug to be used in particular segment, particular disease segment. This is because this drug you have patent, you have lot of advantage into this, you have to get it. But you need to understand these 3 things rigorously and work with it very closely, and then definitely get success. In this point, this is a ground reality. I'm talking about experience of last 14 years. Everywhere, people are come, many dogs are not really good, but they're not used because they're not proper channel getting to this clinician to get in for the particular patient. So I don't have much talk. I maybe talk in next time, get opportunity AI, virtual realities, or some other point of views to in-depth knowledge. This is of digital ecosystem, how we can build for them. And thank you so much for this talk. Now I'll go open for the question answer if there are any questions. And I love plantation and hope you too also. And I do have a lot of gardening.
Okay, thank you, Mr. Mahanta, for a great talk. And thank you very much for sparing your valuable time with us. And let me just see if there are any questions on the Zoom platform. Madam, can you see any? I don't find any.
Not in June, sir, but I think some questions we have from this YouTube channel. So
Okay,
YouTube, can I just...
You please go ahead. Yeah, you please go ahead. Yeah.
So there are 2 patients. First one coming from Prabhat Kumar Swai. He is asking, do you believe or satisfy in screening diagnosis system in rural India in this present scenario? Like, what is your take on digital screening in rural poor areas?
Okay, so I'll give example. What's the name?
So a little bit louder, please.
Okay.
Again, I know it is audible, but then I just need some, because students are hearing. So.
Okay, thank you so much. It's a very ground reality questions, and I appreciate for the questions and concern to the public health. What is your mind? I love the question actually. I'll give example. It's last year before the COVID. I was invited one of the smart city project of the state. I'm not taking the name. I'm taking the reality. So, like us, I'm representing a company, particular company, to set up a digital healthcare. What they do, I'll go to the slide. Here the screening. So every company, somebody has developed BP machine, somebody has developed digital glucometer, somebody has maybe lab systems where you can do urine test, rapid test, many tests you can do. But there is no such system available till last year. I'm talking about before a few years. Uh, in integrated with particular box 30 to 40 point of care. We talk about mammography is too difficult task because a huge machine it is at all. But screening uh, cervical cancer, or you're talking about breast cancer, in going to home, it was difficult task. But I'll inform gladly, I'm not satisfied now, or nobody satisfied now. But when talk about there is a problem, definitely there is opportunity. We need to come step forward because we are going to provide the help. Solution to this country. And here is not question for how much satisfied or not, but definitely you need to take it forward now. If it's not satisfied, we have to be create by help of NIT or IIT or any technical team, or individually also you can build this kind of kit where you can screen every day. Is a required technical trend staff who can screen in the village, and thanks to Geo and Airtel and other network, it's come with a bandwidth offline and online version. You can screen it. You can find out proper dashboard in hospital. Maybe it's Delhi, or it's maybe Raulkela, or it's maybe in Bhubaneswar, it's maybe Bangalore, wherever it's maybe you're sitting in Singapore or US. Immediately data will get it and giving a solution, interpretation, and coming to this your mobile app wherever you are standing in village and find the data. If you can collaborate many IoT devices, it's not only Indian made or in country made, let's collaborate it because it required public health. So that's the only solution we can find out. Every Anganwadi Kendra to block or panchayat or check about subdivision, then come to your state board. This synchronization has to be there. Then only the public health can be increased. Or I request the private hospitals, they can do also hub and spoke models. I can visit their hospitals and visit their patient places, or nearby 10-kilometer radius, screen all patients. That's opportunity for them also. Find out particular disease rather than somebody is coming and standing in the queue in the hospitals and going to one department to other department. It's a traditional method. Go digital. Screen it properly. Inform them this disease you do have, and that the screening is the proper solution for them. That's a way I need to go forward for the digitalization. This I need to talk, and we have implemented it, approve it, and this is the way I need to go forward.
So, Mr. Ajit, there is one more question. Like people want to know, the viewers want to know how, when we are talking about digital screening of people, how so a screening machine itself cannot be a doctor himself. So, screening machines can record the data, but how will we correlate the doctors, the digital machines? Like who will analyze and who will give report? And how fast we can get the results, at least the preliminary results, some uh, on time data we can get, so that we can take immediate measures. So basically, okay, people want to know if at all we have this kind of systems or this kind of screening equipments with which is capable of analyzing like 40 to 50 modalities at a time. Then how will we correlate with the analysis part, connecting with the doctors basically?
Okay, okay, and this is very reality questions, and let me take you forward step by step. Uh, as I said, number one slide, the purpose and platform. Purpose is a screening particular disease or number of, it's a normal screening process. And there's a project I was doing ensure the insurance, right? If you see the insurance, number of insurance patients in this country are very less. But I was talking to initiative, this initiative, the insurance company will provide the kit to you. You screen the people and find out what kind of disease, then prepare the package accordingly. This is one. Then your point is here, who will going to analyze, how we going to analyze, because device is in patient place and clinician sitting in other part of thing, and those devices using by particular technical staff. Now, these are two types. One is offline, one is online. So this screening, when taking a BP machine, it's added, it's specific to body. Then during the screening, data automatically flow to the host command center because it's cloud connected to the mobile app to cloud connected. So when screening it, doctor can see in hospital either BP is normal or abnormals. Same time, immediately within 2 to 5 minutes, analyze report coming to you also. If it is a lot of AI system is coming in future, also and few are there coming already, they'll give you data analysis either is abnormal or abnormal, normal or abnormal reports. Same thing happened to lipid profile, something happened to blood glucose, any other device, taking ECG also. And devices are now become getting small and it is very compatible. And there is a law of your ultrasound, 3 law, if they allow or not, please check it out before going to screening. I think you need to go to stick into the policies. We're not supposed to use ultrasound or 3 law. You need to follow it actually. And we'll talk about a little bit of digital IC. Maybe you heard about digital IC. In tier 3
A
cities,
little bit louder, please.
you'll talk about digital ICU, right? So in ICU intensive hospitals in tier 3 city is a difficult task because you not get anesthetist, you not get particular ICU intensive doctor. Now it's available called digital ICU. So there is a center in Bangalore. ICU intensive doctors are sitting in a particular center or they're in home. And there is camera system, it's called radar or different camera system. They completely in ICU in tier city is focused to camera to your drip drug delivery systems completely. They observe data lively, and from there commanding to nurse what drug you have to be added what time actually. And it is completely innovative way to save the patient. Rather than one emergency patient, they have to be take one place to other place by road or I don't have much infrastructure in heli ambulance here. By road, within 3 to 4 hours, maybe patient die. But we have digital ICU now. That data interpretation happen lively. Few systems. It's required. It's required. Complete the platform has to be sustainable and best platform. Then only you can use it actually. Many other things are available now also. Same thing happened to. I'll talk about few other screening also some other time. So these are the things we need to follow offline and online versions. Now this data are more speed, maybe some places where you can use online version. That is the only solution you can give interpretation models. Even you talk about teleradiologies, ultrasound radiology data, because radiology are very less in country, right? From your X-ray report to your brain MRI report, how fast you get the data. If you'll remember, if you'll go to hospital by somebody like me or somebody gone to hospital, waiting for a report after getting MRI maybe 1 hour time or 2 or 3 times. And once report come, maybe next day come report or have lunch and come, you'll get report. But now, even having CT or MRI in other center, radiology sitting other center, now teleradiology report, 5 minutes, that time is 5 minutes to 45 minutes. You'll get report with interpretation of radiology signature particular place, and you'll get the report now. That's everything happen online now. From your temperature to MRI, whatever you do. Same thing happened to lab. Also, somebody pathology is not available, but lab is there. You can find out lab report, upload in system. You'll get immediately lifetime also. This is a new era, and we need to be encast this kind of systems and use platform and motivate to other to use this kind of platform. This is the way to go forward. So I hope I answer your question.
Yes, Mr. Ajit. I would like to ask, like, whether it's really in what systems it's actually operating, in how many settings this is operating, because this is quite new and relatively it's not so much popular because people doubt. So I just want to know, is it replicable to all other parts, and can we create such kind of scenarios, and we can join all these scenarios to one platform, actually not too many platforms, but one platform where people can join and do this kind of things. Like it's a state based, or it can be a India based, and or it can, how far we can think of, what big things can think of.
Your question, if I'm not wrong, what I understand is a data security point of view talk about, or like you're asking for
Just
user
no, my
user point of view.
user point of view is.
Okay. So when talk about user point of view when creating a platform, right, it's basically three things involved in front page. One is equipment, other is mobile app, other is a cloud-based platform. Platform is like mobile app, or you can use your like web version, or you can analyze data in the backside because a lot of things happen when preparing a platform. Right? Calculation
So
happen
just
when
Mr. Ajit, so I think when doctors are connected through mobile apps, they have to register for a particular program. Is that so?
yeah they have to register when suppose we talk about Dr. Ajay, I got a receive from particular places. There is a pop-up come up and I need to be interpreted a particular case. So I'll get a message. They have to be registered actually, right? Few are the registered, few are their close circles like teleradiologists. So you have to be I mean join this group or talk about or tele-ECGs, you can join with their group. If you're good about your clinical point of view, you can also join there. I can interpret as soon as possible. So as platform are good, available, and still developing according to market requirement and getting smoother and smoother. And this is what's going to happen in market scenario.
So I think we have covered major things, and later on I suggest due to already we have exceeded our time, so we have to again get ready for the next session. So
Okay.
with this, I would like to thank Mr. Ajit Kumar Mahanta, and with
Okay.
his lot. Yes, I'll just try to end the session by just hand overing to Dr. Rohan Dhiman. So I think I have covered major of the questions. Over to Dr. Dhiman.
Thank you, ma'am, for taking up the questions. I think so. There were many from YouTube streaming, so it justifies your intent of live streaming this particular session on YouTube because many people they are also joining there and they are closely going through all the talks. And once again, I thank Mr. Mahanta for joining with us. And for this session, I want to again extend my thankfulness to Professor Mukherjee and also to Ajit sir for joining with us. It was really a wonderful session and hope all the participants who have joined through either Zoom or YouTube streaming must have found it very informative and helpful as far as their future endeavors are concerned. So once again, thank you very much for everyone and hope to see all the participants again in second session. So thank you very much, ma'am, for giving me this opportunity. Thank you, ma'am.
Thank you so
sir.
much, Dr. Rohan.
Thank you, sir.
Thank you, Dr. Vismita. Thank you so much for
Thank you.
Thank you, everyone. Yeah.
Yeah, thank you, everyone. So with this, we'll end the session. And if some questions are left, maybe we can take it with Mr. Ajit Kumar Mahanta and the people who are really interested in going for such kind of ventures and digital marketing and healthcare systems and want to set up their own marketing and company related to healthcare. Probably they can directly connect to Mr. Ajit Kumar Mahanta and he will be, I know that he will be more than happy to assist anyone for any further questions and assist them with whatever they need to know. So probably with this, we'll end this session and we have a session again coming up at 2:30 p.m. So although we'll open the session a little bit earlier, but at sharp 2:30, we'll start the session. And for now, I would say thank you and bye-bye for now. So with this, I'll just end the session. Thank you, everyone.
Thank you, madam. Thank you.
Okay,
Thank you, everyone.
Thank you.